reason why bariatric surgery fails, and failure is even quite a controversial term in bariatric circles, but the reason why it might be seen to fail is because people are just absolutely delighted after their surgery, some people, at the idea that they lose weight almost irrespective of what they do. So if they don't use the golden opportunity of that almost miraculous weight loss that happens initially, if they don't seize that golden opportunity and really throw everything they have at revolutionizing their lifestyle, changing their approach to food, eating, to dealing with their emotional triggers, how they deal with themselves in the world. People need to go into bariatric surgery with a particular mindset. When you get wheeled into theatre, you have to understand that on the other side of your surgery, when you come out of theatre, your anatomy is going to be changed, and you have a 6 to maybe, if you're lucky, 8 or 9 month opportunity on the other side, where your physiological response is going to be completely different. For 6 or 8 months, you're going to have this dramatic restriction. You're not going to be able to eat that much. And in all likelihood, you're not going to be that hungry. It's not true for everybody. Some people still have a lot of hunger, but you're not going to be able to eat that much, and you're not going to have as much hunger as you do pre-surgery. Also, there are some hormonal and endocrine changes in your system that mean that for a short period of time, you won't be as compulsive as you are pre-surgery. So you have this short window, but you will be fooled if you think that this is your new normal. And the mistake that a lot of patients make, and I made it in part, is in believing that your surgery has removed your eating disorder. And so so you have to get wheeled into theatre knowing that on the other side, your true healing begins, but it's not physiological. You're afforded this reprieve for a while, but in that reprieve, you have to realize that the true work is psychological, emotional, even spiritual, and you have to use that time where you don't want to eat, where you're not that hungry, and where you're not that compulsive and hectic around food, to actually confront your demons, do the work, sit with your feelings, sit with your powerful emotions, learn other tools and skills and strategies for coping with life on life's terms, be in therapy, be in support groups, and have a different language and method for doing life, so that when at 8, 9, 10 months, all of the pre-surgery realities land right back on your doorstep with a vengeance, and it happens quickly. You don't need to panic because you're ready. You have the skills and the tools in order to rise to the challenge, and you're not panic-stricken. Because it's at that point that many people come knocking on my door, absolutely horrified that there's been a almost overnight return of hunger, compulsion, the urge to binge, overwhelming emotion and craving, and they know with almost certainty that they're going to return to their pre-surgery selves, physically and emotionally, if they don't get a handle on it fast. So best to do that work from day 1 out of surgery, if not before.